Yeah, that's the first study testing the use of Teclistamab as maintenance therapy in newly diagnosed transplant-eligible multiple myeloma following autologous cell transplantation. So at ASH 2024, we presented the initial results of the safety running portion of the study, which tested the combination of Tec-Len and also Tec-Alone. So what we showed are two things mainly. The efficacy is huge. Among all the tested patients, all of them are reaching MRD negativity, and almost all of them are reaching CR. So this is the first part. The second part is that even in a newly diagnosed transplant-eligible myeloma population, so less pretreated, younger, the infection signal is there. So we have to take care and to be careful about this. Approximately 30% of the patients got grade 3 or 4 infection, mostly upper respiratory tract infections. That could be managed. So the good news is that we can take care of this, manage. So absolutely immune globulin replacement is highly recommended, and antibiotic prophylaxis as well. So those are mainly the most two messages. Now the phase 3 portion of the study is already open and actively recruiting, so that's a huge study, 500 patients across the whole globe, so we will see what the final results will be.